All right, welcome everyone. Today we're taking a deep dive into the world of nephritic syndrome,
Yeah, nephritic syndrome.
a condition that can seriously mess with your kidneys and how they work.
Uh-huh.
We're going to break it all down for you using
We're going deep.
yeah, we're going deep, drawing from a video script we have.
Yeah,
And by the end, you're going to have a solid grasp on this thing, nephritic syndrome, like way beyond just the basics.
exactly. Think of it like we're translating a visual journey through your kidneys
Yeah.
right into a captivating audio experience.
Okay, so let's get to it. First off, what exactly is nephritic syndrome? The video script mentions these little filtering units in your kidneys called glomeruli.
The glomeruli.
Yeah, and they're like the cleaning crew, filtering your blood and keeping things running smoothly.
Right, and when those glomeruli get inflamed, that's when things start to go downhill. The inflammation messes with their ability to filter out waste and excess fluids.
So it's not just about the kidneys going on strike, it's a specific kind of dysfunction because of inflammation, right? Okay, so the video script, it distinguishes between nephritic and nephrotic syndrome. And I gotta admit, those sound awfully similar.
Yeah, they do sound similar, but a key difference is whether there's blood in the urine. That's called hematuria.
Hematuria.
Yeah, and if you see like reddish or brownish discoloration when you pee, that's a pretty strong indicator that it might be nephritic syndrome.
Okay. That's something you definitely wouldn't want to ignore.
Absolutely not.
No. Now, the script mentions 5 common symptoms of nephritic syndrome. Let's walk through those. You want to take the lead on that?
Sure. So first, as we just talked about, you have hematuria, blood in the urine. Then there's edema.
Edema?
Yeah, which is swelling caused by fluid retention.
Yeah.
So you might see puffiness in your face, hands, and feet.
Like after a long flight. I hate that.
Haha, right. But in this case, it's not just temporary. It's a sign your kidneys aren't working like they should.
Right, yeah. Okay, what else?
Then there's hypertension, which is high blood pressure. And that happens because the inflammation messes with your kidney's ability to regulate blood pressure.
Wow, so the kidneys are involved in blood pressure too. They really do a lot.
They're multitaskers for sure. And you also might have decreased urine output,
Okay.
simply because those inflamed glomeruli just can't filter as much fluid as they normally would.
Right, so less filtering, less pee. Makes sense.
Exactly.
Yeah.
And finally, there's fatigue and nausea, that feeling that something just isn't right.
Yeah.
And that's because waste products are building up in the body because the kidneys are struggling to eliminate them.
Ugh, that sounds awful.
It's definitely not pleasant.
Okay, so I've got the what of nephritic syndrome down. Let's dig into the why. The script categorizes the causes as either primary or secondary. What's the difference there?
Well, primary causes are the ones that directly attack the glomeruli, causing that inflammation.
Okay.
So, for example, you have post-streptococcal glomerulonephritis. This often pops up after a simple throat or skin infection caused by, streptococcus bacteria.
Wait, seriously. So like a minor infection can trigger this whole cascade of things that ends up impacting your kidneys?
Yep, that's right.
Wow.
Then there's IgA nephropathy and crescentic glomerulonephritis. Basically different types of inflammation that directly affect the kidneys.
So it's all about understanding the root cause, right? Because depending on what's causing the inflammation, the treatment will probably be different.
Exactly. Nailing down the specific cause is key to treating it effectively. Now, secondary causes, those are a bit more complex. They involve other health conditions that eventually damage the kidneys.
Right, like the video script showed. They used a split-screen visual to show how infections and autoimmune conditions can eventually lead to nephritic syndrome. It's like a domino effect.
A perfect analogy.
Yeah.
So, for example, lupus and other autoimmune diseases where your own immune system attacks your body can cause inflammation in the kidneys.
Right.
You also have infections like hepatitis or HIV that can damage the kidneys, and even some medications or toxins can have adverse effects.
So it's not always a direct attack on the kidneys. It can be a consequence of something else going on.
Exactly. Like the kidneys become collateral damage.
Yeah, exactly.
Mm.
That makes a lot of sense. And it just highlights how everything in our body is interconnected.
Absolutely.
Okay, so let's say you suspect you might have nephritic syndrome. What happens next? How do doctors diagnose it?
Well, the first step is usually urinalysis to check for blood, protein, and other abnormalities in your urine.
Okay, so analyzing the pee.
Pretty much.
Yeah.
And then there are blood tests to see how well your kidneys are functioning and look for signs of inflammation.
Gotcha.
But sometimes those tests aren't enough to get the full picture.
And that's when they do a kidney biopsy. The video script mentioned that briefly.
That's right. It involves taking a small tissue sample from your kidney to examine under a microscope.
Sounds a little scary. Is it painful?
It's usually done with local anesthesia, so the discomfort is minimal.
Okay, good to know. But why is a biopsy so important? Seems like a pretty intense step.
It is, but it gives doctors crucial information. They can actually pinpoint the exact cause of the nephritic syndrome by looking at the tissue.
Oh, so it's like zooming in to get a high-definition picture of what's going on.
Exactly.
Okay, that makes sense. You need that level of detail to figure out the right way to treat it.
Precisely. And the video script showed a doctor consulting with a patient, emphasizing that treatment isn't one size fits all.
Right.
It really depends on both the cause and the severity of the nephritic syndrome.
Okay, so let's talk treatment. What are the options?
Well, the script outlined three main approaches: medications, lifestyle changes, and managing any underlying conditions.
Makes sense.
So for medications, they often use corticosteroids and immunosuppressants to fight the inflammation, especially when autoimmune issues are involved.
So basically calming down the immune system's attack on the kidneys.
Exactly.
Okay.
Then there are antihypertensives to manage blood pressure and diuretics to help reduce that swelling by getting rid of excess fluid.
So different meds for different aspects of the condition?
Right. But it's not just about pills. Lifestyle changes are super important too.
Yeah, this script mentioned those as well.
One big one is following a low-sodium diet.
Yeah, because sodium makes you retain water, right? Which would make the swelling worse.
Exactly. By cutting back on sodium, you're helping your kidneys manage those fluid levels.
Gotcha. And then there was that thing about staying hydrated, which seems kind of counterintuitive when you're already dealing with fluid retention.
It might seem that way, but trust me, staying hydrated is crucial for kidney function. When you're dehydrated, your kidneys have to work even harder to filter waste, and that puts more stress on those already inflamed glomeruli.
Ah, so you're actually helping your kidneys out by giving them enough fluids to work with.
Exactly.
It's all about balance, huh?
It is. And speaking of things to avoid, remember the script warned about those over-the-counter pain relievers.
You mean NSAIDs?
Yep, those. While they're commonly used for pain, they can be tough on the kidneys, especially if you already have a condition like nephritic syndrome.
Right, so even things that seem harmless can have a negative impact. It's a good reminder to be mindful of what you put in your body.
Absolutely, and always a good idea to talk to your doctor before starting any new medications, even over-the-counter ones.
Good advice. Okay, so the last approach was managing underlying conditions. Why is that so crucial for nephritic syndrome?
Well, in a lot of cases, nephritic syndrome is a result of something else going on, right? Whether it's diabetes, lupus, an untreated infection, or even exposure to certain medications or toxins.
Right, so it's like treating the root cause rather than just the symptoms.
Exactly. It's like fixing a leaky faucet instead of just mopping up the water.
Love that analogy. All right, that covers a lot of ground on nephritic syndrome. Anything else we should touch on before we wrap up this part?
You know, one thing this script subtly emphasized was the importance of early treatment.
Right, right.
Because the longer this condition goes unchecked, the more damage it can do to your kidneys. Early detection and treatment can prevent serious complications later on, like chronic kidney disease or even kidney failure.
Wow, that's serious. So recognizing those early symptoms and getting medical attention is crucial.
Absolutely. It just goes to show how powerful knowledge can be. The more you understand about nephritic syndrome, the better prepared you are to take control of your health.
Couldn't agree more. And speaking of knowledge, I think it's time to take a quick break. But don't go anywhere. We'll be back in a flash with more insights on nephritic syndrome. Stay tuned.
See you soon.
Okay, so we've talked about how taking care of your overall health is important for your kidneys, but what about specific things you can do every day to keep those bean-shaped organs happy? The video script had some helpful tips on maintaining good kidney health.
Yeah, it boils down to a few things: managing any chronic conditions you have, treating infections quickly, and staying on top of regular checkups.
Makes sense. You wouldn't just ignore a leaky faucet,
Yeah.
right? And your kidneys are pretty important for, staying alive and all that.
Exactly. And managing any chronic conditions you have, like diabetes or lupus, is key, because those can put a lot of stress on your kidneys, making them more susceptible to damage.
Right. It's like a double whammy. You're dealing with the original problem plus the potential impact on your kidneys.
Exactly. And we talked about how infections can trigger nephritic syndrome, so dealing with them promptly can help prevent that domino effect reaching your kidneys.
It's like stopping those dominoes before they reach your precious kidneys.
Exactly. And regular checkups. Those are all about early detection.
Right. So if something is off, you catch it early, and that can make a big difference in treatment and how things turn out.
Absolutely. Regular checkups let your doctor keep an eye on your kidney function and catch any red flags early on before anything serious develops.
Like a preventative maintenance check for your kidneys?
Exactly. And even if you've already been diagnosed with nephritic syndrome, continuous monitoring is crucial. You and your doctor are a team working together to manage the condition and prevent any long-term problems.
A kidney care team. I like it. Before we move on, I wanted to circle back to those kidney biopsies. You mentioned they give doctors a really detailed look at what's going on. Can you elaborate on that?
Sure, a kidney biopsy is like a magnifying glass for doctors, allowing them to see the tiniest details of what's happening in your kidneys. It helps them determine the specific type of nephritic syndrome you have, how much inflammation and scarring there is, and what the best course of treatment would be.
So it's like getting a personalized roadmap for managing your condition based on your unique kidneys.
Exactly. It really shows how important individualized care is. What works for one person might not work for another, and a biopsy makes sure you get the most targeted and effective treatment.
Right. Makes sense. Now, switching gears a bit, the video script talked about the long-term outlook for folks with nephritic syndrome. It said some cases can be cured, but others might need ongoing management. What factors play into that long-term prognosis?
Well, there are a few things that come into play. The underlying cause, how severe the condition is at diagnosis, the person's overall health, and their response to treatment.
So it's pretty complex with lots of variables involved.
It is. Like if the nephritic syndrome is caused by a treatable infection, the outlook is usually good. Once the infection is gone, the kidneys often recover fully.
It's good to hear.
But if the cause is something like an autoimmune disease, like lupus, then managing it long-term is usually necessary to control the inflammation and prevent further damage.
So in those cases, it becomes a chronic condition that needs careful attention.
Exactly. But it's important to remember that even with ongoing management, people with nephritic syndrome can live full and happy lives. The key is being proactive, listening to your doctor, and making healthy choices that support your kidneys.
It's about taking control of your health, right? Now, I know we've talked a lot about this condition already, but I'm curious about advancements in nephritic syndrome research. The video didn't really cover that. Are there any exciting new developments in the works?
Oh, absolutely. The field of nephrology is always moving forward, and there's a lot of promising research happening around nephritic syndrome. One focus is developing more targeted and effective treatments with fewer side effects.
So finding treatments that zero in on the root cause without causing other problems.
Exactly. And they're also doing research to understand the genetic and environmental factors that play a role in nephritic syndrome. They could help with better risk assessment and create even more personalized treatments.
Tailoring treatments to individual genes and environmental factors, that's fascinating.
It is. And there's growing interest in the role of the microbiome, the trillions of bacteria that live in our gut, in kidney health. Some studies suggest that imbalances in the gut microbiome could actually contribute to kidney disease, including nephritic syndrome.
Wow, so our gut health could impact our kidneys too.
That's what the research is suggesting, and it opens up a whole new area for potential treatment. Imagine being able to adjust the gut microbiome to improve kidney function.
It's like a whole ecosystem inside of us that we're just beginning to understand, and it makes you realize that everything is connected, even down to the microscopic level.
Absolutely. It emphasizes the importance of a holistic view of health and well-being.
And speaking of connections, I think it's time to connect with our listeners and start wrapping up this deep dive into nephritic syndrome.
It sounds good to me.
So to our listener, we hope this journey has given you a better understanding of this complex condition. We covered the causes, symptoms, how it's diagnosed, treatment options, and even peeked into the latest research.
And most importantly, we highlighted the importance of being aware of the early signs, getting medical help right away, and being an active participant in your healthcare.
Well, we've really dug deep into nephritic syndrome today, haven't we?
We have. It's been quite the journey through the kidneys.
From those tiny little filters, the glomeruli,
Yeah, the glomeruli.
to the long-term effects and even the cutting-edge research, it's fascinating stuff.
Absolutely. And we've really tried to cover it all. The mechanisms, the symptoms, the diagnosis, treatment, you name it.
And I especially loved that glimpse into the future of treatment. Targeted therapies, personalized medicine based on genes and environment, even the gut microbiome.
The microbiome.
Yeah, it's amazing to think we might be able to manipulate that to improve kidney health.
It really is. The field of nephrology is constantly evolving. It gives me hope for the future of managing this condition.
Yeah, there's always more to learn and discover.
Exactly.
Well, before we wrap up completely, I want to make sure we achieved our goal here. Empowering our listeners with a solid understanding of nephritic syndrome.
I think we did a good job of that.
Yeah.
We broke down this complex condition into bite-sized pieces, explaining the causes, symptoms, diagnosis, treatments.
Oh, without getting too bogged down in medical jargon.
We tried to keep it clear and easy to understand.
Yeah, make it relatable for everyone.
Right, because at the end of the day, knowledge is power. Understanding nephritic syndrome gives you the power to take control of your health. Spot those warning signs early on.
And get the help you need.
Exactly.
So before we say goodbye, what's the one big takeaway you want our listeners to remember?
I want them to know that even though nephritic syndrome can be serious, it's not a life sentence.
Yeah.
With awareness, proactive care, and a good relationship with your doctor, it's absolutely possible to manage it well and live a full, healthy life.
Well said. And to our listeners, if you're experiencing any of the symptoms we talked about, please reach out to your doctor.
Don't wait.
And if you've already been diagnosed with nephritic syndrome, know that you're not alone. There's support out there, and with the right approach, you can handle this.
Absolutely. Keep learning, keep asking questions, and be an active part of your own healthcare journey.
That's great advice. Keep those kidneys happy and healthy, everyone.
And thanks for joining us on this deep dive.
We'll see you next time for another fascinating exploration into the world of health and science.